We are Group 5. Today we are going to present about effects of aging on cardiovascular health. Effects of aging on cardiovascular health. The first one, thick and hard heart valves. 2. Slightly enlarged aorta. 3. Thick left ventricular wall. 4. Myocardial infarction is less effective. 5. Receptor-less pressure control.
Table 19.1 Aging and risk to adult cellulation. Causes or contributing factor. Decreased elasticity of blood vessel. Increased resistance of peripheral vessel. Decreased coronary blood flow. Reduced proportion of oxygen extracted from arterial blood by tissue. Reduce cardiovascular responsiveness to adrenergic stimulation. Nursing diagnosis. Decreased peripheral tissue perfusion. Intolerance to activity. Decreased cardiac tissue perfusion. Decreased cardiopulmonary tissue perfusion. Intolerant to activity.
Box 19-1 Indication of ineffective tissue perfusion. Hypertension. Tachycardia. Diseases. Poor quality. Claudication. Edema. Loss of hair on extremities. Tissue necrosis. Stasis. Answer. Dyspnea. Increases respiration. Pale coolness of skin. Cyanosis. Decreases urinary output. Delirium, alternate cognition, and level of consciousness. Restlessness. Memory disturbance.
Cardiovascular health promotion by teaching the young and old to identify and lower risk factors related to cardiovascular disease. Nurse promote optimum health and function.
Purple nutrition. A diet that provides all dietary requirements maintains weight within an ideal range for high and egg as control cholesterol intake is beneficial. Box 1922 reads some general dietary guidelines for reducing and risk of cardiovascular disease. Some nutrition supplement can also help cardiovascular health.
Dietary guidelines for reducing the risk of cardiovascular disease. 1. Reduce the intake of fried food, animal fat, and partially hydrogenated fat. 2. Increase the intake of complex carbohydrates and fiber, such as oat, barley, corn, and barley. 3. Maintain calorie intakes between ideal ranges. Reduce consumption of nutrient-poor foods. 4. Use monounsaturated oil and omega-6 oil. 5. Eat fish rich in omega-3 fatty acids at least twice weekly. 6. Reduce intakes of red meat, sugar, and highly processed foods. And the last one, limit alcohol beverages.
Adequate exercise. A sensible distribution of exercise throughout the week is advisable and is more beneficial to cardiovascular function than a periodic spurts of activity. The lack of physical exercise, known as physical conditioning, can heighten many of the age-related functional decline and aging people can experience. A slower rate of decline and improved cardiovascular status has been found in the middle-aged person who exercise regularly. Nurses can encourage persons who dislike scheduled exercise programs to maximize opportunity for exercise during their routine activity. 30 minutes of moderate physical activity at least 5 days per week, or 20 minutes of vigorous exercise at least 3 days per week are the recommended level to reduce the risk of cardiovascular disease.
Cigarette smoking avoidance. Although many smokers are aware of the health risks of cigarettes, beginning the habit is quite difficult, and for this, people need them to be told to stop. In addition to avoiding cigarette smoking themselves, nurses can instruct people to limit their exposure to the cigarette smoke produced by others, which also can be detrimental.
Stress management. Stress is a regular thing in our life. Nurse can teach you how to find people who are stressed, symptoms, and get out of stress condition. Many reducing stress activities such as yoga or meditation can help almost people who are stressed. Gerontological nurse tell us to mark a good health when we are still young before getting old.
Thank you for your attention. Have a nice day.